Okay, we're broadcasting now.
Got
Hey,
her.
good evening. I'm just saying good evening to everyone. We know when they're going to join, Doc. So we'll have people joining here soon. We'll get started promptly at 7 o'clock. Okay, go ahead, Doc.
I was just gonna say I forgot the other doctor's name already.
Nicole Ainsworth.
Nicole.
Yours actually says it on my screen, which is helpful. Really small up there, yeah. I don't know if it does that for everyone, but.
Doc had to switch over, New had to switch over to her phone. So I'm wondering
Oh,
if
it probably doesn't on there. No, never.
Yeah. Oh,
I have a cheat sheet.
which
yeah.
is good.
Integration with my laptop, so.
I have a gallery of 3 animals watching me right now, so hopefully they're quiet.
Did you get another animal?
Well, I have lots of animals. We have 2 dogs.
2 dogs.
We have a cat now. Do you want to see him?
Yeah.
Right here.
Cool.
She should have been a veterinarian.
Cat.
Oh my God.
Oh,
He's a big boy.
he is big.
We have a turtle and 3 fish. Actually 4 fish. So yeah, we got quite a menagerie of animals.
So is that you or your husband that loves animals, or both?
Both of us, that's the problem. So like we never are one to talk each other out of getting another animal. So here we are. We got him last Christmas.
Wow, he's a big boy.
Yeah, he's a sweetheart.
He's pretty.
I've never had a cat before, and it's a new experience for me. I didn't realize you can't train them. Like they're untrainable. Like they just do whatever they want to.
Oh.
Well, I think that's
at least this cat. Like he's super sweet, but like if he wants to eat your straw out of your drink, he will get it. He will take it, and he will keep doing it. You can replace your straw. He'll steal the other ones. Yeah, he's a funny animal.
Does he go outside at all?
We don't let him outside because he's kind of dumb, and I think he'd get hit by a car. So no, he pretty much stays inside. We'll let him out in our backyard that's fenced in every once in a while. He's just sitting on my lap now. I don't know if you can see him.
Oh my gosh.
He's funny though. Yeah, I always wanted a cat when I was a little girl, but my brother was allergic to him, so I could never have one. So this is like living out my childhood dreams, I guess.
He's handsome.
Yeah, he's a pretty boy. He's a little bit of trouble, but he's a pretty boy. All right,
I like it.
put him down. There you go.
He might come back up later. Doc, you don't have any animals, do you? Or do you? What do you have?
I got 2 dogs.
You do? I didn't know that.
I feel like a lot of people in Aspen are dog people, except for Dr. Shash and Dr. Joe.
Yeah, and Dr. Shash likes my, oh gosh.
Yeah,
Oh,
I like this.
there's that fluffy one. We can just talk about our pets the whole time. That's fine.
We'll have your questions on it. Oh, it's 7 o'clock. Okay. Well, welcome everyone. Good evening. I'm Crystal Freitager. I'm the Senior Manager of Academic and Industry Relations. Thank you for joining us for our AMA tonight. I'm fortunate enough to have 2 of our lead dentists with us tonight. I have Dr. Nicole Ainsworth from Ottumwa, Iowa, and I have Dr. Nule, and she's from Council Bluffs, Iowa. So we're going to go ahead and get started here, but let me do just a couple of housekeeping tips really quick. Down below is a Q&A function on your screen. I'll be working that Q&A function for the doctors. If we have questions come up, I'll work through those and get those posed to you guys as well. I also have those pre-submitted questions that everyone submitted in prior using that Google registration form. So I'll be going through those questions tonight. We're going to try our best to get all those questions answered. However, if you guys have additional questions after tonight, you all have my email address from the registration form, so you can certainly email me and I will, I'll respond with the answer for you. So with that, for those of you that don't know, Aspen Dental is a dental support organization, and we provide the non-clinical support for the 800+ dental practices nationwide. And again, we're fortunate enough to have 2 of our lead clinicians with us, and I'm going to go ahead and let them get started with introducing themselves to begin with. So Dr. Nicole, let's start with you.
Hi, I'm a 2017 grad from UMKC. If you don't know where that is, I think most of you probably do, unless you're from Creighton, but it's in Kansas City. I had a very brief stint out of dental school in New Mexico, and I now live in beautiful southeast Iowa, Ottumwa to be specific. And I'm our MCD down here. I'm mostly here by myself, but we get to have a lovely oral surgeon come visit us every once in a while too.
Awesome. Welcome, Doc. And Dr. New.
So I graduate. Hi, everybody. I graduated the same year as Nicole, 2017. Funny she mentioned Creighton because I graduated from Creighton. I've been in Omaha, been staying in Omaha, Nebraska. I just moved down a state to, Council Bluffs, Iowa, to be an MCD there and I've been there for 3 years, all by myself.
You moved like 15 minutes away, right?
Across the state. That's like, that's a step.
Absolutely. Awesome. Well, thanks, doctors. Let's go ahead and get started with, let me pull up the first questions here. And I thought this was interesting that we got this one. But it says, what did you find most frustrating when starting your professional career out of dental school? So Dr. Nicole, you want to start off with that one?
Sure. I don't know that frustrating was the right word for me, probably more like overwhelmed, but I think those emotions can kind of be a little bit the same sometimes. Just how differently you can do things and the products available, because I know most dental students were pretty straight-laced and we want to follow everything by the book and do everything the one perfect way. But there's always more than one correct way to do something, and a ton of products out there that we probably didn't have our hands on in dental school. So just kind of filtering through all that, reading instructions on products I didn't know how to use, and, just going in and being confident with things that I'd maybe used never before or for the first or second time. So that was a little bit frustrating, but, you just roll with the punches and learn new things, and probably find something that you liked a lot better than you did in dental school. But it can be a little bit overwhelming or frustrating right at first.
Yeah, that makes a lot of sense for sure. And Dr. New, how about you?
Time was what I was frustrated with for the first, I think, 2 or 3 months of it. It's like the very first thing. And then, when you have like a full schedule and everybody's waiting on you and you took like an hour and a half on a crown prep, it's frustrating. And you work with different people, different assistants, and then you get the front staff, and then sometimes when you're new you don't know how they move, and then if you happen to work with like another new dental assistant, it's like frustration on top of frustration because you also have to coach another person. So time is for me, and then sometimes working with, a new assistant that you're not, get used to first. Yeah.
Oh, I can see that. Absolutely. Everything's new to you guys when you first come in, right? With it. Yeah. So that makes a lot of sense. Excellent. Mm-hmm. Let's move on for our next one. And I thought this was pretty interesting too. So maybe you guys will have some tips or tricks here. I've heard that getting a license can take a while. Any tips on how to do this the quickest? Dr. Nicole, start back up with you. Any tips on when you got licensed? I know we were talking about this earlier, so.
Yeah, every state is going to be a little different. I know in Iowa, our jurisprudence exam is pretty intense, but I think it's open book. It's a little bit easier now. But I would just say to get in touch with the dental board. They usually by email or phone, both in New Mexico and Iowa, they were really helpful. And I know when I was first getting my license in New Mexico, they actually let me submit almost all of the paperwork ahead of time before I even finished boards. So I had all of that in there. All I had to do was get my board scores in once I got all that information. And I had my license probably a month before some people in Missouri or other places. So I think that was really helpful. And I wouldn't have known I could do that if I hadn't just asked somebody that worked for the board. So that's really all I could say on that.
I think that's great advice. So Dr. New, how about you? Anything else that you did different?
Well, when I applied, I wasn't sure if it was going to work for Iowa or Nebraska. So my thing was I applied for Nebraska and Iowa at the same time because my test would have proven for both states. I think what proven to be the longest was, I forgot what that test was, but you have to go in and get your fingerprints or whatever. And that took So the soonest you get it done, the better, because I don't know how fast it was. But when I got mine, I was pretty early and it took a long time. And once that is done, everything else pretty fast. So that's all.
Great.
Yeah.
Yeah, I think both those points, great advice, ladies. Thanks so much for that. So moving on to when did you start interview opportunities? And did you wait till you have your boards completed, or did you start interviewing prior? Dr. New, we'll start off with you.
I didn't wait for the board, but in honesty, when I apply or when I started looking was like January or February, senior year, it wasn't a lot of opportunities. And later on, not until like May, when there's a lot of offices start looking, because that's when they know there's going to be a lot more graduates coming out. Mm-hmm. So when you're break or doing nothing at all, start in winter, just kind of prep yourself. But I would advise you not to be over worry about it, because opportunities always popped out. Like if you didn't see it, when you research it in, the end of your junior year, it's going to be like a lot more when it comes March, April, May, even June. Because I have a bunch of my friends who had different experience looking for jobs, and I kind of wish I would not be over, worried about not finding a lot of job opportunities when I started out.
Mm-hmm. Good point. Yeah. Thanks, Dr. Nguyen. How about you, Dr. Nicole?
Yeah, I probably didn't start really looking until the fall, and I went on a couple interviews over like Christmas break, but I don't know of anybody who didn't find a job, and some of them I don't think found what they were looking for until summer even. So yeah, that's great advice that Dr. New had, that nothing to really stress that much about. It's good to have a lot of different opportunities just so you feel which one's the right fit for you, but that doesn't mean that something else won't come up if it doesn't feel like it's the right time, or they need someone sooner, or how things change. Like she said, some people, they need someone, they need them right then, and so opportunities change quickly.
Yeah, makes a lot of sense. The next thing is interesting enough here, wanting to know, did you work during COVID? Did you work during COVID, or were you laid off at all? So Dr. Nicole, you want to start with that one?
Sure. I was not. I was working, and obviously it slowed down a lot, and I spent way too much time looking at the computer for the ADA and the CDC and the all the updates. And at the end of the day, I just there's a lot of great information out there, but it can be overwhelming. So I didn't get laid off, short story, but we kept up with what Iowa was doing and just made sure we were following all of the protocols while we were open, seeing emergency patients. And it was a little slow, but I think we did really help some people that really needed help at that time. So it was still rewarding, even though it was slower than we're used to at work, for sure.
I can imagine. Doc, did you also do teledentistry at that point, or were you just open for emergency patients?
I didn't, but I know some other doctors in our region did that. But no, I was just in the office ready to see them when they came in.
Awesome. Thank you for that. And Dr. New, how about you?
I wouldn't say I got laid off, but I didn't work. So when it first all blew out, I was like, so Dr. K is the owner office, just for, students who's listening. Dr. K is the owner office of 3 or 4 offices in my region. And I just called him, and I told him, like, I'm not comfortable yet because I got parents close and I don't want to bring it home, and it's so unpredictable. And I told him I was worried. So then we make a decision of closing my office. I feel like it's part of me want to lay myself off. So I took myself out for like a month, and I think it's over a month. I started the end of March and being home at the end of March, and then I didn't start working until second week of May. Yeah.
Okay. And Doc, did you start back with any teledentistry too, or what did that look like when you came back?
I didn't do any teledentistry.
Okay.
we started back with just like skeleton crew, doing emergency, because state of Iowa was still in a state of emergency. You can only do, emergency dental work. So we were on that for like 2 weeks, and we kind of rotate our staff to limit exposure, and then it slowly got to full staff, and I think 3 weeks after or so,
Okay, excellent.
they got open to everybody.
Excellent. Thanks, ladies.
Yeah.
The next thing I have here is, okay, I'll be interested in what you say. How much do you recommend I save as a new grad to get through until I start practicing? And then did you have to pay for your licensing? So Dr. New, do you want to start with that?
I thought I did, but no, I didn't have to pay for my, I don't remember if I paid for my licensing or not. I don't think I did. I think it worked in as my my part of contract with Aspen. Correct me if I'm wrong. I don't remember.
Well,
but after that, like your renewal, you pay for yourself. But I think my first one, my licensure got paid by Aspen. How much you have to save? I honestly wouldn't worry too much about saving the money. I actually advise you to spend it because you're gonna earn a lot more. So if you have the money, go spend it on not a time for vacations, but spend it on something that you know you have, places you want to go, people you want to spend on, to like use that money on that. I wouldn't say, put a saving aside, because whatever you have now, you're gonna have a lot more when you start working.
Enjoy life, right?
Yeah.
Excellent. And Doc, let me add to that. So each of you have a practice owner, and you're able to negotiate what your offer is with those practice owners. So we have what the Aspen Dental averages are, and then you were able to negotiate that with Dr. Komanjaro for yourself, Dr. New, right?
Yeah, yeah.
Excellent. And Dr. Nicole, how about you?
I didn't have much time off, honestly, because I got my license so soon. I started working, I think, 4 weeks after I graduated. So it was pretty quick. So, I mean, enough to pay your rent, I guess, for a month or so. And I saw a lot of people went on really awesome vacations. And I'm not saying that's a great use of your money, but part of me wishes I'd had an extra week to go on vacation, because it's a lot of stress and you've been through a lot. So I wouldn't shame anyone for going on a last hurrah after dental school. But as far as saving a ton of money after that, I paid for my license, but it's a chunk of money. But as long as you can pay for that and make it through a few more weeks, I don't think you really have to worry too much besides that.
Excellent. Good advice. The next thing I have is, do you eventually want to own a practice? So both of you guys are lead dentists, or MCDs, managing clinical directors. So let's start with Dr. Nicole. Do you eventually want to own a practice?
That's a great question. We actually talked about that the other day. I definitely wouldn't rule it out, but with everything going on, and I'm a little bit neurotic when it comes to my student loans. Like, I want to pay those down so bad. That's like my whole focus pretty much right now. So not right now, but I know that there's an opportunity there if that changes in the future, which is really great because you don't always have that option working other places.
Excellent. Thanks, Doc. And Dr. New, same question for you.
It's a question that I ask myself every day. And every day I ask myself, I have a different answer for it. Yes and no. It depends on where you are in your life, to be honest with you. I personally, at this point, do not want to own a practice, just because I don't want to deal with all the business part of it. I don't want to go home and have to worry about, hey, do I make enough money to pay the rent, the instruments, this DA, that DA, yada, yada, yada. But, hey, in about a year or two, that might change. I don't know.
Yeah, yeah. And the nice thing is that that opportunity, you know, could be there for you guys if that's the point that you want to look at it. But right now it sounds like you're both happy in your lead positions, which is awesome.
Yeah.
Very cool. Um, the next one I have is now we're getting kind of into a little bit more of the clinical. But before I do that, let me ask this one just so I can kind of stay in the line here. Did you consider a GPR? If not, why? So Dr. New, you want to start with that one?
No, well, I did not. I had full faith in Korean that I had a really good education, because even before then, when I talked to different dentists like outside, and they always says that you guys are the most well prepared, graduate I've ever met, deal with, or the people I hired that from Korean is the most prepared one, and I took their word for it.
Mhm.
But also, like, who I talked to who had done that program would tell me that you're basically working with a lot less money, and then the experience that you're hoping to gain is not as equal or as good as you would value it to be spending a year doing that, or a year or two doing that. So you might as well start working and earn your experience that you're hoping to gain for that. And if the main reason you think you're doing the GPR is because you think you're not ready, you're never gonna be ready. That's the thing. um, like, obviously, the only reason I ever even consider GPR is because, hey, I want to do implants and I want to learn to do that. But if you're doing that, you're still like, if you've been doing, for my thought, I would be like, hey, if I do a GPR, I would still be a student. I still have to check with this person, that person. Um, and I might as well just go out, practice. And then when I got, my clinical skill, I got it to where I want to be, it wouldn't be a hard thing to learn to do implants and all that, or, further improve my skills. So,
Great insight. Like
yeah.
that. Dr. Nicole, how about you? Same question.
Yeah, I don't have a lot to add to that. I think those are good points. I know I was just really done with being in school, and maybe somewhat foolishly, I felt pretty confident in what I knew when I got out. I knew that there was a lot of things that I could still learn, but I thought I'm have a solid enough foundation that I think I can do CEs and learn and kind of tailor my learning to what I'm interested in, instead of kind of just doing a full program. So, yep, I didn't think about it very much. I was like, yep, I'm ready to be out of school.
Oops.
Oh,
Good additional thoughts. You're good. You're good.
oh, no,
Um,
oh, she's back.
Okay. Back. Okay.
you're back. Just got another Q&A in here, and they're asking, how long did you work as an associate before taking on the role as MCD? So Dr. Nicole, how about you first of all?
I think 3 months. And I had a really great mentor come down and work with me. He drove about an hour and a half from Des Moines to come do a lot of surgeries with me, because that's a big thing I know at a lot of Aspens. But that was one thing that, single teeth extractions I was pretty comfortable with, but doing really big cases and doing a lot of them, he helped me out a lot with that. And once I was feeling comfortable, he was pretty much like, I think you're good. You ready to do this? And I was like, yeah, let's do it.
Was that Dr. Tassine?
Yeah, yeah, Dr. Joe and Dr. Shash has come down to do some surgeries, and it's interesting how many things they do alike, but then the things they do differently. So that all kind of ties back into, there's always more than one way to do something. So it's really cool to see multiple points of view on that and kind of make it your own from there.
Yeah, absolutely. Dr. New, how about you?
Not as fast as her. I started in July. I started in July after I graduated, and then not until January of the following year. So about 6 months. Yeah.
Okay.
Well, to be
Yeah.
fair, I'd worked at another office for a year, so you're still faster than me overall.
All right, that's good to hear.
I love it. We've already got competition going. Yeah. This is interesting too. So, do you discuss pricing with your patients? So, for either one of you guys, and Dr. New, how about you? Do you discuss pricing at all with your patients?
I try not to. That's a line that I don't want to cross. But sometimes, I mean, that's like it's their mind. It's like number one thing that they want to know is before you finish your sentence, how much is going to be. So yes and no. Usually I was like, hey, my girls are friends really good about this. I would not be the good person to ask because I don't know about your insurance, but they would, make sure that your pricing is good. The estimate is about this time, but that's like without your insurance or out of pocket, but we don't know what we can do help you with. So yeah, sometimes I do, sometimes I don't. Most of the time I don't.
But it sounds like you give them kind of a ballpark instead of a specific because they may have insurance that would impact that, right?
Yeah. Like even like when they're prepping for it, I'll give them an estimate. Like, cause they'll be like, "Oh, how much is implant usually run, or how much is your highest denture usually run?" And I'll be like, "This and this and this."
Yeah, makes sense. Dr. Nicole, do you do anything different?
I try and avoid it like the plague. I don't want them to think I'm avoiding the question. So yeah, if they pin me down, I'll give them a rough estimate. But I'm like, we have a great person who specializes in insurance, and sometimes she's able to, work with you on costs for things to make it fit in your budget. So I don't want to quote you the wrong price and then have it be different. So I'll give them a very vague ballpark, but I'm like, but yeah, let's get you in with Rebecca. She's going to take great care of you from here. She'll answer all your questions about the financial part. So
Excellent.
yeah, I try to avoid it. I really hate talking about it so much.
Yeah.
Well, it makes sense because you're really, focused on that clinical side and the treatment plan you just built. So it certainly makes sense. Excellent. Let's move on then, ladies. Do you refer cases to specialists outside of Aspen Dental? Dr. Nicole, you want to start with that one?
Sure. Pretty much molar endo, and then pathology. I know that our oral surgeon, he's great, but if he's concerned that it's going to need a biopsy and going to need follow-up, he really would prefer a local oral surgeon to deal with cases like that. So like sinus lifts and biopsies, things like that, we refer out to a local oral surgeon and then molar endo. But besides that, we're pretty much able to do everything else. We don't do like huge like implant supported dentures with like 8 implants that never are removed, but we do the removable type of implant retained dentures.
And Dr. Nicole, you have an oral surgeon, you have Dr. Belil that's there. And how often is he there?
He's there just about once a month. We try and get him to come more, but he's a busy guy. But yeah, he does great with our more complicated impacted molars and just really big cases where people are really nervous or have a complicated medical history. So we're happy to have him. We'd try and get him to come more if he wasn't so busy.
I can believe it. And I'm sure Dr. New does too. Doc, same thing for you. What does it look like for you for referring out to specialists?
And honestly, it really depends on like, how many specialists Aspen is having for you. So, within Omaha Council's region, I know we have endodontist and Dr. Bullock, so our oral surgeon. So most of the time, we keep it within Aspen just because it's easier for the patient with their financing, and we're just able to give them a quote. But when they come in with the emergency like 4 impacts and they want to get it in the same day or the next day, it's better to refer them out to local oral surgeons so they can get it in urgently. You have specialists within Aspen, but they only come to your office in like specific time. So I reserve those for like full mouth cases that the patient wants sedations. Pathology, like we said, I just give it out to locals because they're easy to monitor it better. Let's see what else. Sometimes I refer implants out for front aesthetic parts. Like I got a couple of oral surgeons I like how they restore the implants, so I keep referring to them. So it really depends on like who you like and if you like their work or not. Yeah.
And it's basically, I guess ultimately it's your choice as right.
Yeah, there's no pressure to keep it in office if you feel like it's in the patient's best interest, for sure.
Yes, excellent. Let's see, keep track of where I'm at. This is an easy one. How many dentists work in your practice, and are you able to get time off? So, Dr. New, you want to start with that one?
There's only one dentist in my office. So it's really tricky if you want to get time off. just because you have to like coordinate, hey, I'm taking, you know, July off a couple of days. Like, you think you can come to my office? This is me talking to, you know, my owner doctors. I'm usually picky when it comes to who covers my office. Just because, I mean, like, I don't want to come back and fix other people's stuff. I just rather not even take my time off. So when you, you know, the MCD of the office, you deal with the same problem, because it's you know, it's it's possible. It's just kind of hard to take those time off. Yeah.
So does the owner then cover your practice? Is that what you're saying?
Well, usually I have Dr. K come over to cover my office. Yeah,
Okay.
if I get time off. But that was like, you know, the story of last year and the year before. I don't know what's gonna happen this year.
So he was the one that covered it in the past couple of years.
Yeah, Dr. Chopra covered it once or twice.
Okay.
Yeah.
And that's an associate within your practice, right?
Yes, yes, yes.
Okay, makes sense. And Dr. Nicole, how about you?
There's just me, except for Dr. Bolel, or when we're really lucky and one of our owner dentists pops down for a day, and we kind of abuse them and put a lot in their schedule. But I've never had trouble getting time off, but I totally see where she's coming from, that you don't, for me, it's usually a temp doctor that covers me. And it's not that any of them are bad. It's just they have different philosophies sometimes, you know, on saving your teeth, restoring teeth, putting big fillings in versus doing crowns. And so that's kind of the awkward part, is coming back to a treatment plan that maybe they made, or a treatment plan of yours they changed, and then figuring that out. But I still take my time off. I'll deal with it if I have to. I'm going to take my vacation. So.
For sure.
But I've never had any trouble getting time off. The only time I had a day that I didn't get off, it was like a week's notice, and I didn't think we'd be able to get a temp doc, but there was a concert, so I tried. It didn't work out, but it's okay. I didn't need, obviously this was before COVID anyway, since there's not many concerts anymore.
What concert did you miss?
George Thorogood. My husband really likes the one bourbon, one scotch, one beer song. That's like the only song of his I know. I'll play it for you later, Crystal, if you don't know.
Perfect. I don't know if I've heard that yet. I've heard another one. Awesome. So the next thing I have is, does Aspen take insurances, Medicaid, PPOs, etc.? Do you run into situations where negotiated rates are much lower than what you would normally charge? So I'll let you ladies talk through that one, and then I'll help if you guys need that. So Dr. Nicole, you want to start with that one?
As far as I know, we take like all of them besides Medicaid. And once again, maybe it's just me avoiding the money part, but I really don't pay too much attention to what we get compensated for it. You know, I don't want to, if I'm doing a filling, whether it's $100 or $400, I'm going to do the same filling. So I try not to dwell on it too much, and I feel like it all works itself out in the end, and I'm not too concerned with the nickeling and diming on the insurance part.
Mm-hmm. Dr. New, you're shaking your head. Sounds like you agree?
Yeah, I got nothing to add to that. I know nothing. I would have answered the exact same thing she did. So
that's perfect. I think the thing that's great to know too is, again, with Aspen Dental supporting those non-clinical side, right? We have an entire insurance department that manages that. As an owner, because both of you guys have owners for your practices, they'll see when our contracts come through on an annual basis to be able to review that, to know what it looks like for reimbursement. But our insurance department, again, so you can focus on dentistry and not have to worry about that. The insurance department, they're watching that UCF, that usual customary fee. So that's being handled for you on the backside from Aspen Dental Management. So one of the nice things that they're able to do for you. So awesome, thanks, ladies. The next thing I have is, do you, and this would probably be for Aspen Dental, does Aspen Dental, or do your owners would offer paid CE for the dentists that are working in the office? So maybe you guys could talk about what you've had for CE. Dr. New, you want to start with that one?
If you're talking about, like, you know, the ADA CEs or the AGD CEs, no. Aspen will have like specifically like website that you can look into your resources, but they will also every year have specific, you know, courses that Aspen like you to follow. So, example, last year, the big thing about Aspen is Invisalign. So they'll send the doctors in for, you know, learning about Invisaligns and all that. So that's your C of the year. So just the big things. This year, I know it would have been implants and all that big stuff, but and then COVID hit, so I don't know where that go. We had a bunch of CEs online, but nothing hands-on yet. Um, but if you really worry about, you know, if you're missing out on, you know, up-to-date current information CEs, then your better bet is to join your region's dental association. You know, like if I was, for me, for example, I'm with the Nebraska Dental Associations, and that's where I get all my updates and all my requirements of CEs and anything on top of that. Um, at the end of my 2 years, I usually have enough CEs. I didn't have to go anywhere else, but I don't, honestly, I don't go on Aspen website to get my CE credit. I usually like within 1 or 2 years, I'll get enough just by researches or from the associations that I'm with. Yeah.
Excellent, Doc. And Dr. Nicole, how about you?
Yeah, between the EDGE program, which is what you do when you first, well, first few months anyways, I guess is usually the goal, right? When you join on, I can't even remember how many Cs I got from that. Like it was a ton of them. And then the Invisalign, which was a really fun event. Dr. Galler is a blast.
Yeah.
Yeah, I had more than enough. And the funny thing was you're exempt from it your first year in Iowa. Anyways, all of these CEs that I didn't even need for my renewal. But yeah, there's still a ton of opportunities. I haven't explored too much of the online ones with Aspen yet, just because I've had it all covered and pretty much felt like I had all the up-to-date stuff for now. I did take oral surgery CE in January, right before all this stuff started. And that was cool. And that was through the AGD. And that was a good course, but there's a ton of opportunities. So if you're concerned about having to pay for CEs or whatever, I'm sure you can pretty much get those all covered just through doing things with Aspen. So yeah, I'm worried about that.
Yeah, for sure. And we do have, and Doc, great on the EDGE, and you're right, that does offer a lot of CEs. I think when you probably went, it was at 6 or at 18 CEs probably.
Yeah.
We also are offering through March of 2021 to anyone in the industry where they can join our website for free CEs, and that's aspendentalce.com/welcome. And those again are accredited CEs, so they can join that as well if they'd like to. So thanks guys for answering that. And then let's see, let's move on to, interesting. How would your schedule change if you did own the practice? So if you became an owner, I guess, would your schedule change? So Dr. Nicole, let's start with you.
I can't imagine that it would unless I got 2 associates. Yeah, I don't think I'd probably still just be there. It's 8 to 6 Monday through Thursday right now, and then 8 to 1 on Friday. And we're busy right now. So they actually are bringing down a second doctor to help me out for a couple of weeks because we're booked out so far. I just found out today. I was pretty excited about it. So no, I don't imagine it would change unless, my associate just wanted to climb up the ranks and take over some responsibility.
Excellent. And you are sourcing for an associate doctor for your practice, right, Doc?
Mm-hmm. That would be fantastic. I would love it.
Excellent. So anyone that's out there and hearing that, for sure, looking for an associate doctor to join you in the Atomo practice. Excellent. And Dr. New, how about you?
Hypothetically, if I do become an owner, it depends on really how many practices you're owning. Because if it's at your sole practice, you might as well spend your whole time with practice. But if you got like, 2, 3, 4, and depends on how the other practices are doing, if they need help or not, you might spend half a day here, half a day there. I have Dr. K come in to help me for a couple of hours sometimes just because I need help on one of the cases. Or I know he'll drive to Lincoln, spend a day or two at the other practices because they need help, building up the patients and all that. Once you become the owner, like I said, unless you only got one sole practice you focusing on, you're going to have to be like, your mind is everywhere. So, or you could have to, outsourcing yourself everywhere, depending on where it needs you.
Yeah, and a lot of the owners then at that point when they have multiple practices, they're in mentoring their lead doctors or their associate doctors. So maybe that schedule looks different because they're rotating through some of their practices. Again, they're the owner, so they're determining how they want that to look. But I think what you guys said was good insight on that. So thanks so much. I have another one here. Are MCDs compensated based on percent of production or percent of actual collection? So who wants to start with that one?
Nicole will start. I don't
I'm pretty sure it's collections. Am I right, Crystal?
It's an average of both.
Okay, there we go. I was like, oh, that's a great question. But even if you're not getting your bonuses off of that, like we're still compensated very fairly for, even if you have a slow month, you're still guaranteed to be able to pay your student loans and your rent and everything, which is fantastic, especially with everything that's been going on here lately. So you always have some steady income, and then everything else is just kind of gravy on top of it most of the time.
Yeah, absolutely. So to walk through that, it's a two-part compensation plan, and you have a guaranteed rate, Dr. Nicole, which what you were talking about. And on average, again, you can negotiate with your owners when you're talking about the offers, but on average, it's a $600 daily rate. If it's an associate, they're going to earn 8 to 10%. If it's a lead managing clinical director, then that's double that. So they're going to earn 16 to 20%. And that's off of the average collection and production. So it's the combine of the two. Awesome. Dr. Nicole, anything you want to add to that? Or Dr. New, anything you want to add to that? Okay, good enough. Okay, the next one I have. Do you pay for your liability insurance? So Dr. New, you want to start with that?
I thought we have liability insurance.
You do, and yours is probably paid for by your owners, by his PC, by Dr. Kilimanjaro's. Is that correct?
That's all right.
Uh-huh.
No, that's what I thought. I think once you sign up for Aspen, you automatically have liability insurance just because it's kind of, when you start practicing, you can't avoid it. But I personally don't have to pay for it. No.
Yeah, and yeah. I will add that you negotiated that with your offer, and so Dr. Kilimanjaro's practice does pay for that for you. So you're absolutely right for that, which is awesome. And then Dr. Nicole, how about you for yours? Because you have a different owner.
Yeah, same. Yeah,
it's paid. Okay, great, easy from both of you guys there. Next one I have is, how has COVID impacted you in your practice? I know you were talking about that one closed and one stayed open. So let's talk about probably post, now opening and how that's impacted. Dr. Nicole, you want to start with that?
There's almost like so many little things. It's hard to like summarize. But my biggest thing is my bottom line is that I'm going to follow what Iowa legally wants us to do. And there's things you can do above and beyond that, of course. Like we are wearing street clothes in and changing out and, only having our scrubs on. We have a mask on the entire time we're in the office. We limit everyone in the waiting room. If there's, more people trying to come in, we have them wait in their cars. We don't let people back in the treatment rooms unless it's a child or a dependent of some sort. So just like a ton of little things. And then the respirators when we're doing procedures, and, you know, it's a lot, but, you know, you kind of get into a routine and it doesn't seem so bad. At first it was just like overwhelming, and I was reading stuff again on the CDC and trying to keep up with every little thing. And I just found it so overwhelming that I was like, I'm gonna do what feels right above and beyond anything Iowa is, you know, mandating that we do. And so, yeah, just lots of little things, but honestly, wearing a face shield, it's kind of nice. I didn't like it at first, but I see all the stuff on it when I take it off, and I'm like, oh, that was kind of gross. Like, I think I'm always going to do this. So I don't know. Sometimes change is for the better, I guess. Maybe we can learn a few things.
Right. Now it's becoming normal, right? Dr. New, anything to add for that?
No, I think she covers everything. It's so tedious to start back up again from the gowns that you wear, all the extra PPE. I have like 4 layers of everything once I'm done putting stuff in, or I start sweating everywhere.
Yeah.
It's tough. Man, people get so mean after you got back from the after you get out of the pandemic. Like, I don't know, everybody's just angry for some reason.
Yeah,
so that's the education part to deal with as well. But you know,
we all need to chill.
yeah.
So it doesn't sound like you're having any problems with getting PPE. I'll ask that since I'm sure I'll get it as a follow-up. Any issues with PPE?
No, we get stuff sent to us. Sometimes we didn't even ask for it. I'm like, oh, cool. We got plenty of those. We get a lot of different types of like respirators and different face shields. So we kind of have options. Some of our assistants like one better than the other. We all kind of mix and match, and just, yeah, we haven't had a shortage though, because, yeah, we've been good. Like, I'm not even really worried about it. Anytime I'm even like close to being worried that we're running low, it seems like we get something else shipped to us. So we've had to use some like off-brand cavi wipes and things a few times, but that's really it.
Excellent. Dr. New, anything? Are you guys having any concerns?
No, we always have plenty of PPE. We're never short anything. So, yeah.
We do have the Smile Wide, Smile Safe promise that started when we started back, where the majority of the offices open back up. And besides all the things, Dr. Nicole, that you talked about with how we're handling it for patients, there's also that promise that each practice will have a 30-day supply of PPE. So you're not concerned. And that's probably why you're getting things that are getting drop shipped to you that maybe you haven't ordered, because you'll be on that cycle to make sure that you always have something on hand with that 30-day supply. So that's awesome to hear that it sounds like it's working well. Very cool.
That's really one thing I really love about Aspen is that they make sure that you got the supplies that you got. Because from, you know, following the COVID when it happened to the time that everybody's been open, a lot of what I've seen, like people with private practices are having problem with getting hands on, you know, masks, N95s is always short, or they really can't get that PPE that we are having so much of, or never have that fear of not having it. So.
Yeah, fortunately, because we wouldn't want that for you guys at all. That's for sure.
Yep.
The next thing I have is, can you tell me what procedures you like to do in your practice?
Oh,
so, Dr. New, you want to start with that?
I like extractions. I can do that all day. I hate fillings. That's all I can do. Yeah.
Love surgery, not so much fillings.
Yeah.
Dr. Nicole, how about you?
Kind of similar. I do like doing like some anterior fillings or crowns too. Those are fun. Had a lady just the other day, we did 6 crowns for her, and she was like crying. She's like, I haven't wanted to smile for 20 years. And I'm like, oh my God. And I think she would have hugged me, except for we don't do that anymore. but yeah, those are fun too. But I don't think I realized in school how much I like doing extractions. It's just kind of like immediate gratification. You feel like you help somebody out right then and there, and they're usually really grateful. Some of them are really nervous and a little bit queasy, but for the most part, they're pretty appreciative when you're able, especially to do that sometimes the same day we try and fit those in.
Excellent. And the next one I have is, how involved are you with denture patients or partial patients? So who wants to start with that one?
How involved?
Yeah, how involved?
I'm
And I'm
not
not for
dating
sure.
any.
Yeah, maybe with the fabrication. You can take it however you want to take that angle.
I would guess, yeah, that they just mean like and I mean, I would say everything. We're involved in everything. We get to work with our lab techs too. So if they have a question, that's what's really cool about having the lab right in the back, is if they're like, by your note, did you mean they wanted to show more teeth or the midline was off? And you can confer with them about that. And then you get your pick of what labs, if it's like a metal framework or for crowns and stuff too, you can send it to any lab you want to. And we're even using our Itero scanner for a ton of those, and they mostly come back fitting like perfect, which is awesome because I hate taking impressions for partials. It seems like there's always a bubble or something somewhere. So yeah, that's been really cool. So I guess very involved. I'm not dating anyone involved that has a partial, but very involved in the process of making them.
Very cool. Very good. And it's nice that you're now taking that digital impression then to send that out for
I love our tarot scanner. I hate taking regular impressions pretty much in general now. I'm spoiled. I don't know how I would ever go back at this point. And the margins on our crowns, I feel like are fantastic. So yeah, I'm spoiled now.
When
That's
do you
cool.
start? I probably just get your email and then ask you where you send your front crowns to. But that's like Aspen thing, Nicole.
Yeah.
Yeah, go ahead. I'll make sure you guys have each other's contact. Okay, that's
Yeah.
excellent. Dr. Nicole, I have a question that came in for you. And since you were talking about crowns, do you mill? And I think you may have actually said something in this last part. But do you mill your own crowns in-house, or do you send them out to a lab?
We do not mill them. I don't know. Aspen's always innovating and getting new stuff, so I don't know if that's ever in the works. But no, we don't. And I did work where we had one, and while it's really cool and it's neat, and I mean I like the service of being able to do it the same day. It's just a lot of time to actually plan them and to actually digitally alter them yourself. And it's a lot of chairside time that you could be pulling teeth, doing more fillings. I know how much we love doing those. So I kind of enjoy not having the burden of me doing that. We still send it all digitally. And then we have a lab that it comes back, the contacts are perfect. It seems like I hardly ever adjust occlusion. And when we were milling them at the other office I worked at, I felt like the margins weren't as good, the contacts were high. So I don't know if that was error on my part. It certainly could have been, but I love having them come back from our lab. And it's not, if it's something we do later on, we have lab techs, so I'm assuming they could be involved in that process with us and maybe not have all of that to do on your own someday if that ever happens. I don't know.
Sounds like you like what you're doing though, with how your process is working for you right now, right?
Yeah.
Yeah, that's great. We've got like 10 minutes left, so I'll look through and make sure that I get everything or as much as I can. So I have, what are the typical patients that you see every day? You've talked about liking extractions. Do you see a lot of that? And that's just in general, I guess, to both of you, because there's not a particular name. So Dr. New, you want to start with that one?
Really depends on your regions, to be honest with you. But Aspen, we're known for a lot of dentures, right? I don't know if there's exceptions somewhere, but I've seen a lot of dentures patients, whether it's going to be like full mouth extractions or making a lot of dentures. But the majority of the patients I do see is dentures every day. You get to love them.
So, Doc, are they coming in looking for dentures? Is that what you're saying? So they come in and that's what they're looking for, or?
Both. They come in looking for dentures, or they come in with teeth, but they're damaged teeth, and then you have to do the extraction, talk to them about dentures part. I mean, obviously you do your fillings and crowns and all that too, but you do see a lot more denture patients in general.
And Dr. Nicole?
Yeah, I would say that we see a lot of emergency patients, so that ties into the extractions. And then we do see some like teenagers every once in a while, and we actually we have a pretty big Amish community nearby us, so we see they'll kind of sometimes the whole family will come at once. So that's usually sometimes still just fillings and dentures though, but there's people that want aesthetic work. I'm doing a 9-unit aesthetic case right now, but that's pretty unusual to be honest. And I wish that more people would do implants down here, but it's still a bit of a hard sell. We do some of the implant retained dentures, which I wish more people would do for their lower dentures, but middle-aged, I would say, middle to lower income is a lot, and then a lot of emergency patients that haven't been into the dentist in a long time, and they're pretty much only coming because they're in pain, but you get the chance to hopefully turn things around if you're able to, or if not, at least get them, get infections out of their mouth and get them healthy and getting them wanting to smile with some pretty new dentures if that's what they need.
Nice. And hopefully you've got a lifelong patient, right?
Yeah. Hopefully they don't need too many adjustments though.
Yeah, exactly. And let me put out like a last one here. Um, let's see. Well, let's do this one. So, well, I'm going to combine these two because one is asking, did you make tough mistakes your first year? And the second one is, what advice would you give to better prepare me for my professional career? So I think those could probably be together, right?
Mm.
So Dr. Nicole, you want to start with that one?
Sure. The practice I worked at was actually really slow my first year, which I guess was good in some ways because I didn't really ever feel real pressured or rushed, but bad because I couldn't even pay my student loans. I was almost working like part-time, and that that was frustrating on that end. So I would just say make sure that you're really really aware of the opportunity that you're getting into, because I think some people think they're going to need a full-time dentist, but they really don't. And especially if you're working in private practice, like they're not going to pay you to just sit around. So make sure that you have the patient flow and that they really do truly need a full-time dentist if that's what you're looking for, which I feel like most of us probably are fresh out of school. And then I just wouldn't do anything you felt that uncomfortable with, because there is specialists for a reason, and you can take more CEs if that's something you're interested in, you want to work your way up. So, it's never a bad idea to push those boundaries a little bit, but you have to have that confidence in yourself to know when I don't want to do this. Don't let a patient or anyone else pressure you into doing something you really don't feel comfortable with.
Oh, great advice, Doc. And Dr. New, you're going to have the last word.
Oh boy. I love what Nicole was saying. For me personally, don't work on your parents their first year when you get out.
That's a good one.
Please do not. Wait until you have a good grasp of what's going on. And then, then you can start working on them. Not because you're not that well prepared yet, but you may be not that well aware of what's going on, or there's things that you could have thought that you could have done better. That's personally what happened. So.
That's really good advice. I had one more Q&A come in, so I want to try and get this through really quick with our last 5 minutes. And it is, so Doug, I guess you might still have the last word. Let's see. It says, how do you make your removable dentures? Do you use traditional method, wax rims and wax try-ins? How many visits? So which one of you would like to walk through your denture steps and the visits?
I guess I can go first because Nicole went first last time. So different from the school, you get like 8 steps and probably 2 or 3 more of adjustment when you had in school. Aspen condenses it to 4 steps. So you got your impressions of first visit, you got your wax bite second visit, you got a wax try-in third, and fourth is delivery. And then they can have, the adjustment schedules after that. So yeah, a lot shorter than it was if you get it done at the school.
Absolutely. Dr. Nicole, anything else to add?
Yeah, I think the biggest thing for me was using the dentures as a custom trait, which in general, especially when people come in with dentures that are 30 years old and they're like, I love them, I want my new ones to be just like them. Letting your lab tech actually see their denture and it's mounted and they can make sure the teeth are as close as possible, and that, you know, if they have a really high palate or arch or something like that, it really helps, I think, get a great impression. And if something, you know, if there's a bubble or it's not overextended or something, there's a bunch of little tricks and things that I've learned and people have taught me to you know, keep the process moving, not like, oh gosh, we have one bubble, we got to bring them back in for a whole new impression and we got to start all over. Like, you can keep things moving and get them done, yeah, in a few days sometimes if your lab and their schedule all match up, which is pretty cool, because it was like months in dental school.
And you got
Nice
to
having, It's nice having your lab tech. What would you guys do without a lab tech? Would that be okay?
I don't want to know.
Well, thanks so much, ladies. Dr. New, Dr. Nicole, you guys have been great. I really appreciate you coming on and answering all the questions that the students have. So you guys have a great night. Good night, everyone else. Stay safe, ladies, and we'll see you soon. Take care, doctors. Bye-bye.
Bye.